we're resuming, but this time fortnightly. So from now on, you'll get an invite to these every 2 weeks. We felt it's important, and we know that COVID hasn't gone away, and neither have your questions as media colleagues. So we want to make sure that we provide the right messaging for our residents through you, and you've helpfully done that for a long time in the past, and hopefully we'll continue to do that for us. So welcome back. We've now got on the call today the Director of Public Health for Nottingham City, Lucy Hubber. We've got the Public Health Consultant for Nottinghamshire County Council, Louise Lester. And we've got Amanda Sullivan, the Chief Accountable Officer for the NHS Integrated Care System. So the usual format applies. If people who are familiar with this can remember, you'll hear from all of our panelists one by one. They'll give you their perspective of the pandemic from a public health point of view and then NHS point of view. Then there'll be the opportunity to ask questions. And if you can raise your hand if you want to ask a question, we'll come to you in turn if we can. And then if you can limit your follow-ups to one, if possible. And if you can keep your microphones and cameras muted throughout, unless you're speaking to one of the panel members. And without further ado, I will hand over to Lucy Hubber.
Hi, good morning, everyone, and great to be back with you all. I hope you all had a lovely summer. Certainly no shortage of things for us to talk about in relation to COVID as ever, and particularly following the announcements this week with the winter plan. There's quite a lot of activity, really rapid activity taking place across Nottingham and Nottinghamshire, and Amanda's going to give you an update around the vaccinations, which is definitely where we're placing a lot of our attention and focus now. For Nottingham City, it's been an interesting summer in that we've had very sustained, relatively high case rates. So we've been in the high 300s pretty much all the way through July and August. And it's only in the last couple of weeks that we've begun to see a decline in our case rates. So currently in Nottingham City, we're at 263 cases per 100,000. That's compared to the England rate of about 297 per 100,000. And we've looked really carefully and closely at where we're seeing that decline. And it's across all areas of the city and across all age groups. Very encouragingly, we've also seen a reduction in the positivity rate. That's the number of people who get tested, who go on to have a positive PCR test. And that suggests to us that the amount of COVID currently in Nottingham City is actually reducing. But it's still very high. So the positivity rate's about 7%, and really we need it to be below 3%. So although it's reducing, which is reassuring, it's still much higher than we would want it to be. And at 263, our case rates are higher than where we would want them to be, particularly as we're going into the winter months. And what we know about infectious diseases, and particularly respiratory infectious diseases, is they thrive in indoor environments. So as the weather begins to get colder and we move from being able to gather outdoors and in beer gardens and outside dining and move inside as we live our lives, we can expect to see case rates increase. We're also seeing nationally increases in school-age children as schools return. Actually, at the moment in the city, we're not seeing a startling increase in cases. We have found some cases through testing children as they return to school, but we're not seeing some of the picture that was certainly seen in Scotland and reported earlier this month. The message, therefore, is COVID hasn't gone away. For the residents of Nottingham City, they've been fantastic all through the summer at continuing to wear their face coverings, particularly when they're on public transport or in supermarkets. And to think about how people gather, to try and gather outside where you can, or to not gather in enclosed spaces for long periods of time. And we think that's contributing to why our case rates are beginning to decline. So that's our continued ask. We see really high rates of participation in testing across the city, particularly where people have got symptoms. And as we move into the winter months, even if you're vaccinated, getting tested regularly using the rapid tests when you don't have any symptoms is really important about protecting those around you. Getting tested early, if you have even the mildest of symptoms, using a PCR test is the best way that you can protect yourself and others. So as we move through this into the winter months, through autumn, remembering those key messages: wear a face covering, try and limit your time in enclosed spaces, make sure there's good ventilation or you meet outside where possible, get tested regularly, and as Amanda's going to talk to us about, the importance of getting vaccinated for everybody now over the age of 12. I'll hand over to Louise.
Thank you, Lucy, and good morning, everyone. So I will give you a bit of an update for Nottinghamshire. So our rate currently across the county is 344 per 100,000. So this is a decrease since last week, and similar to the picture that Lucy's mentioned, is a decrease from recent months, but still represents over 2,800 people across the county who have tested positive for COVID in the last 7 days. It's also encouraging to see our positivity rate is also falling, but across our districts and boroughs, as always, there is some variation in rates, but I'm pleased that all of them have either remained stable or are decreasing in the last week. And this is similar to the national picture in that we're seeing rates fairly flat, but with a slow downwards drift. And these rates and the numbers of cases that we have are still higher than we would want them to be. So while it's great that over the summer we've been able to enjoy life being a little bit more normal, and we've seen our local businesses become busy once again, and I'm really grateful for everyone across Nottinghamshire who has continued to follow all of that advice over the summer, taking part in the regular testing over this period, continue to wear face coverings. But we know as we get towards winter, some of those measures that people have got used to doing around kind of meeting outdoors, being in outdoor spaces where the ventilation is much greater, that becomes a bit harder when it's colder. So ventilating our indoor spaces will become really important. And I would also encourage everyone who hasn't yet had their first dose or their second dose to get their jab as soon as possible and before the winter months. So key messages from me, similar to Lucy: whilst the rates may be falling, that is slow and still are higher than we would like them to be. So I'd ask everyone not to be complacent, because COVID hasn't gone away, and that we need to keep up all of those measures that we're used to. So keep washing your hands, keep wearing a face covering, and keep getting those regular tests that you can still get for free. They're really easy to do, and you can keep doing those before you're going to see people, after you've seen people, and please take up the offer of a vaccination if you haven't done. Thank you, and I'm handing over to Amanda next.
Thank you very much. Morning. So we do still have significant numbers of people in hospital who do need hospital care for coronavirus. And on the 14th of September, we had 198 people in our hospitals, 28 of those people needing intensive care. Unvaccinated people or people who are not fully vaccinated are much more likely to need hospital care, and it is really clear that people who are fully vaccinated can still catch coronavirus but are much less likely to become seriously ill or to die. There are extreme pressures on all parts of the health service, and coronavirus is contributing to that, but obviously alongside all the other range of illnesses and problems that people might need help for. So if you do have an urgent health need and you're not quite sure what you need, the 111 service will be able to help you choose best for your needs. Our vaccine programme continues to be a key weapon against coronavirus, and currently around half of our young people, sort of 18 to 29, are fully vaccinated, have had both jabs. But if you are in a position where you've only had your first jab, do come forward for your second jab if it's due. And there is still an open offer for anybody who isn't vaccinated of any age to come forward. You can walk into any of our sites, go to the Grab a Jab website. So if you are not vaccinated yet, there is still the chance to do that. We are also next week, I'm really pleased, starting our booster campaign next week, and this will be for the over 50s, for frontline health and care workers, and people who have got conditions that make them more clinically vulnerable. And those jabs will be at least 6 months after your second jab, and you'll receive an invite for that. Your invite might come either from the National Booking Service, or it might come via your GP. It could be either. And what we will do is prioritise the groups with the most vulnerable, who need their sort of top-up jabs first, like we did in the previous rounds of vaccines. So that's coming online next week. So do look out for your invite and do take that up to boost your protection over the winter. And then next week also, we are starting to vaccinate all 12 to 15-year-olds, so healthy. We have been vaccinating a small number of very vulnerable 12 to 15-year-olds already, but we're now extending this to all 12 and 15-year-olds. This will be delivered as part of the school's immunisation service, and so families will receive information from schools, but that again is starting next week. We anticipate that will run over around a 6-week period. Thank you. That was the things I wanted to say.
Thank you, Amanda. Lots to get through there. I'm sure there'll be lots of questions as well then from our media colleagues. So I'm going to go straight to the floor and ask for questions. And true to form, he hasn't lost the ability to put his hand up first. Hugh Caswell, BBC Radio Nottingham. Good morning, Hugh.
Good morning, everyone. Nice to see you all again. This is for Lucy first, please. It was around about this time last year that Nottingham went to the top of the chart in England for COVID rates. It was attributed, at least, to the return of students. There was evidence of it being driven by students. Lucy, you said earlier this week that you expect rates to increase again as students return this year. I think Freshers Week is starting probably as we speak, actually. So can you tell us a bit about what work is being done, what can be done to try and stop the same happening again, and also what message you would give to Nottingham students?
Oh, you're muted, Lucy. Sorry. It has been a while. We'll let you off.
It has been a while, and it is a Friday. Morning, Hugh, and thank you for that question. I think what I spoke about earlier this week was actually broader than just university students. It's about all education settings. And when you bring people back into education settings, and particularly if you think about school-age children, that they're spending 8 hours a day in a room together, then we can expect to see both an increase in cases within that setting and then transmission back into the household. So I think over the next few weeks, we're going to see not just cases of students in schools, but then translated then to their families and then onward families and so on. So we can expect to see an increase for those reasons. Students, what we know about COVID is that COVID loves a gathering. That's where it thrives. It enjoys a party, it enjoys a pub, it enjoys a nightclub, because it can pass really easily in that environment. And so we're seeing increasing cases in people who are more likely to be in those sort of gatherings. And actually, we've seen over the last few weeks, sorry, that's my dog in the background, I do apologise. We've seen over the last few weeks, as people over the age of 60 have got more confident, their case numbers increasing because they're going out more and enjoying the opportunity to gather. So I think that's the really significant driving factor here. What we know about our students, because of the tremendous work that the universities have done to plan for the return of students, is how brilliant they've been about participating in vaccination. We currently know that 2/3 of our students are vaccinated, and as more students return, particularly the international students whose data we don't have through our current systems, we can expect that figure to increase. The universities have also initiated vaccination programmes on site for students who return who haven't taken the offer up yet, and they've set up really robust testing. and we've been working with them all the way through the summer months to prepare. What the universities have done, I think, that's slightly different maybe from last year, is that they have been incredibly proactive about speaking with students all the way through. So right from the moment that 18-year-olds became eligible, they've been really pushing those messages, really encouraging and seeking some response from students about their participation, and also talking about the importance of getting tested regularly, and about how to gather responsibly. So it feels as though they've been fantastic partners in helping us manage what is going to be an increase in cases just through the very nature, as I said earlier, between the change in the way that people gather, moving to more indoor settings, and the return to normal routine of education, students, and the onward transmission that can bring if we don't manage that more as closely in schools.
Thanks, Lucy. Hugh, did you have a follow-up question?
Yes, please. Yeah, thank you for that, Lucy. This is probably for Louise and Lucy, actually. The deadline passed yesterday, I think, for care staff to get their first jab, for them to be fully vaccinated by the government's November deadline. And are you able to give us an impression at all of how many care staff in Nottingham and Nottinghamshire have not been vaccinated? And more broadly, are you concerned about a possible shortage of staff through the autumn and winter as a result?
I'll let Louise go first on this one, and I'll.
Thanks, Lucy. Thanks, Hugh. So we know that our care staff have had a really tough time over the last 18 months, 2 years. It's been really difficult, and they've done a fantastic job. In terms of our vaccination rates, we know that they are good for our care home staff. I've not got the exact numbers of staff that haven't been vaccinated, but we know uptake has been good, and they've worked really closely with Amanda's team to make sure that everyone's had that opportunity. Just because the deadline has passed doesn't mean that staff can't still get their vaccine. So if they have changed their mind, whenever they want to get it, that will be available to them, and we'll be working through the booster doses as well for those staff. The programme will and our teams will also be working with those staff who haven't had the vaccination to make sure that they can be redeployed if they're not able to do frontline work. And there's a whole lot of work going on with care sector in terms of the market and being able to manage and support that. But our teams within the County Council do a really good job of that throughout the year, not just on COVID. So are well placed to do that, and will continue to do so.
Thank you, Louise. Over to you, Lucy.
I mean, I think that the situation in the city is very similar to as Louise has just described. I think the other thing that's really important to remember with our social care staff is their robust testing. So vaccination is brilliant, but we need to make sure that we are reducing the opportunities for transmission, and the testing regimes in care homes are really excellent, and that will help us be able to manage and control as best as we can, keeping staff in the workplace as much as we can whilst protecting people in care homes. Winter is always difficult and always challenging care homes, so we thank our care home and our domicile, all of our care workers, for their participation in getting vaccinated in the really high percentages that they have, because it is the best way that they can protect those vulnerable people that they work with.
Thank you, Lucy. Hugh, the element about resource pressures, we can come back to you with a perspective from our respective adult social care leads, if that would be of help to you.
Yeah, thank you.
To address that more specific part of your question, if that helps. So we can have a follow-up conversation about that after this, if you want. Okay, let's move on then. So Jack Thurlow next from Nottinghamshire Live. Good morning, Jack.
Good morning, everyone. My question's on Nottingham hospitals, so I suppose it would fall to Amanda. We recently spoke with a chief nurse at NUH who told us that just about the difficulties of hospital workers at the moment that they're facing, but also the pressures that they're seeing now are the sort of pressures that they would see in the middle of January. So I would just like to know from your end, what is the situation like in hospitals at the moment? Is it something that concerns officials? And is it something that could even lead to another lockdown as we head into the winter months? Thank you.
Thank you. Yes, thank you very much. So yes, our hospitals are experiencing extreme pressures at the moment, and it is, as you say, it does feel more like the levels that you would normally see in the winter. And staff are working brilliantly and incredibly hard to deal with those pressures. We are asking people to use your NHS wisely. If you aren't sure, as I say, do go through the 111 service if it's something urgent. Obviously, if it's an emergency, you do need to ring 999 as you normally would. But we are working very closely, and all of the teams are working together, the hospitals, the communities, the GPs, working really closely together to try and make sure that we maximise the services available for people. So we are doing really well in terms of, you know, managing to keep people's tests and things going through, and most of the routine work. But obviously we are all the time reviewing that and the pressures and making sure that we keep people safe. So it is a pressured situation. I think that's true across the country. As we've sort of come out of some of the restrictions, we have seen more people coming into the hospitals for a variety of reasons, but coronavirus is still there, most definitely.
Thank you. And Jack, did you have any follow-up questions for anyone on the panel?
Yeah, I think the next one would fall to Louise or Lucy. I recently read an article actually in Coventry Live about schools numbers for breakouts for COVID cases had come to almost 500. I think almost 500 cases since schools reopened. I was wondering if we had figures about cases in schools since they reopened at the start of last week. Yeah, if you could tell me anything about that, that'd be great. Thank you.
Thank you. Do you want to go first, Louise?
Yep, thank you for that. So I think we've covered this before in previous media briefings, that the definition of an outbreak is actually 2 or more cases that are linked. So 2 or more cases in a school or staff or students is technically an outbreak. As part of the DfE contingency framework, they're also using some definitions for further action, and that can be 5 or more cases or 10% or more of your school. We also know that schools have to report some of that information to DfE and some of that information to us. They don't have to towards the local authority, so we don't always have the most accurate and complete picture of that information. But what we do is offer all of our schools across the county, and I know they do the same in the city, support whenever they are experiencing a number of cases, and we will continue to do that and have done throughout the whole period. So we know that there are schools that are having cases, are experiencing that, and are doing everything that they can to keep their students and their staff safe, and working really closely with the local public health teams, but also with test and trace as needed. And what all of our schools, our staff can do, and pupils and parents, to really help and support the schools, is to continue with that regular testing. So they're still able to get those tests twice a week, which they can do. And obviously, if they're positive, they then need to get a PCR and isolate whilst doing so. And also, we know that this offer of vaccination, which will be starting from next week, will also be really key in hopefully reducing the time away from school that some students have experienced. So again, would really encourage people to take up that offer when available from next week.
Thank you, Louise. Very comprehensive. Lucy, did you want to address the position in Nottingham?
So very similar, actually. We have seen, as I said earlier, we have seen cases being found through the testing when students returned. We are seeing cases within primary schools, and there does appear to be some transmission within primary schools. We're not keeping a track of the numbers in quite the same way because of the changes that the DfE have brought in. And I think that's one of the things that we'll be keeping a very close eye on. We have got a different framework now because of the changes to close contacts and isolation than we had in the last academic year. And it's something that I'm sure across both of the public health areas we'll be keeping a very close eye on, how we can best make sure that schools remain safe. At the moment, we're managing each school. I think if we were to get to to some of the very high numbers that we achieved in some of the earlier peaks, we'd be looking at some slightly different outbreak management. But at the moment, the numbers are relatively low.
Thank you, Lucy, and thank you as well, Jack, for the follow-up question. I think that was a really detailed and helpful, comprehensive explanation of how it works in schools. So let's go to Dale Spridgen at the Mansfield Chad. Good morning, Dale.
Hi there. Hi, gang. Just a quick one, really. Obviously, Mansfield area, COVID's been a really big problem in Mansfield, massively above the sort of national infection rate averages, and we've had a low rate of vaccinations as well. Why do the panel think that this is, and how are we tackling it? Also, are there any particular groups or communities, with higher rates or not vaccinated, and what's been done to reduce the rate and encourage vaccinations in Mansfield area?
Thank you, Dale. It sounds like one for Louise to start.
Sorry, it was a bit long, wasn't it? A bit cheeky.
That's all right.
Thanks, Dale. I'll start on some of it, and then Amanda might be able to add as well in terms of some of the vaccination side of things. So yes, you're right. In terms of rates, like I said, across the county, we often have some variation within and between our districts, and at the moment Mansfield is the highest that we have in the county, but we know during the course of the pandemic there have been different of our districts and boroughs who have found themselves at the top of our list for districts and boroughs. So it does vary. We are working really closely with all of our partners in Mansfield to do everything that we can do to reduce those rates as we are across the county. So working really closely with voluntary community sector, with the district council, and with everyone playing their part in that. So it comes back to the same messages that you will have heard us talk about before. So continuing to encourage residents within Mansfield across the whole county to keep testing, to keep finding any of those cases which perhaps haven't got symptoms but are still infectious, to keep taking up that offer of vaccination, and Amanda can touch more on the opportunities that are available to residents within Mansfield, but also to keep wearing face coverings in areas where they're crowded and indoors, or indeed if possible meeting outdoors is really important still, or keeping areas ventilated as we move to be indoors a little bit more. So lots of things that we can keep doing, and we will keep doing. Pleased that the rates in Mansfield are starting to drop, as are the rest of the county. But you're right, it hasn't gone away, and there's still a lot more that we need to do. So keep on with the same messages.
Thanks, Louise. Amanda, do you want to tackle the second part of that question?
Yes, thank you. So we are still really encouraging people to come forward for the vaccines. And people can go along to the vaccine centres and just have a conversation. If you think you've got concerns about the vaccine, you can just go along and have a chat with a professional who can talk you through for you personally what the benefits and risks might be. So if people are concerned in any way, you can just go along and have a chat with a professional. We're also targeting areas with a lower uptake, which does include Mansfield, as you say. We've got the vaccine bus that's been going around to employers, working with the colleges in the area, and also just different neighbourhoods where there is lower uptake. So we've continued to do that over the summer, and we will continue to do that as well. We've also got local GPs who've been in contact with their patients if they haven't had the vaccine, and been having, again, going through people's concerns as well. So we're trying really every route to encourage people to come forward for the vaccine, because we do know it is the best form of protection, and particularly we want to get people protected as we go into the winter.
Thank you, Amanda, and thank you for prompting that question, Dale. And it was good to end on with Amanda as well, because that is the key message at the moment, isn't it, about the vaccination rollout, isn't it? So thank you all. It's 11:30. I'm going to draw things to a close. I can't see any more hands up from the media. So thank you again, and we'll see you all in 2 weeks from now. Thank you. Bye-bye.
Thanks a lot. Bye.